Are you that mother who feels guilty because your baby had a brachial plexus injury? Then this video is for you. Well, it's very common for mothers to blame themselves when their baby has a problem at birth, as if they could have predicted it, as if they could have chosen the way the birth would happen, or as if they knew the doctor would end up making some kind of mistake. And I see that this is not the reality. You have no control over this. And I'm sure that if you could have chosen, things would have happened differently. Another point is this. Sometimes it is negligence, right? The baby was too big at birth and the doctor should have performed a C-section. Other times, the baby's vital signs weren't monitored and things could have been handled sooner. And sometimes, even when everything is done correctly, unfortunately, the injury still happens. And in that case, there was no negligence. There was a complication, which is something that can happen. We can't blame all doctors for a brachial plexus injury in a baby at birth, because I'm sure that most doctors don't leave home intending to injure a baby. Unfortunately, things happen. However, the topic of this video is about pain. So you must have thought the following. Wow, my baby must be in a lot of pain. He must be suffering so much, poor thing. And I'm going to tell you something real. The pain for the baby is non-existent. It's very minimal, at most just a discomfort. And he won't remember it. And the pain you think he feels won't change his life at all. In fact, he doesn't feel pain. The pain is the parents. It's a suffering because the baby can't move. That feeling of guilt we talked about, which really shouldn't even exist. Complications can happen. What matters is how we deal with these complications. What can we do from now on to help him or her get better? So this video is for you who are suffering at home, who feel guilty, who think the baby is in a lot of pain. He is not in pain and it's not your fault. Now we need to focus on what you can do to help things get better. And here's the thing, there's something really good for you to know. Most babies who have a brachial plexus injury at birth get better without surgery. The most important thing is stimulation. Stimulate as much as possible, encourage movement even if he cries a little. He's not crying because he's in pain, he's crying because you're stimulating him a lot. However, this stimulation helps send information to the arm and increases the chances that he won't need surgery in the future. If you don't know how to do these arm stimulations to help him improve more, don't forget to seek help from a specialist in brachial plexus injuries and an occupational therapist who specializes in hands. These are the professionals qualified to help you ensure your baby gets the best possible outcome. So, take that weight off your shoulders and get to work.